Antifungal drugs is also called as antimycotic drugs, and it is used to treat two types of fungal infections. Number 1, superficial fungal infections, and number 2, systemic fungal infections. There are 9 examples of antifungal drugs, and these are: number 1, Amphotericin B, and this is indicated for most systemic fungal infections. Number 2, Nystatin. It is used primarily to treat Candida albicans. Number 3, Clotrimazole or Miconazole, and this is used topically to treat candidiasis. Number 4, Fluconazole, Itraconazole, Posaconazole, Voriconazole are used systemically to treat various fungal infections. Number 5, Flucytosine. This is used systemically to treat limited number of fungal infections. An example of this is fungal meningitis. Number 6, Caspofungin, Micafungin, Anidulafungin are used systemically to treat a limited number of fungal infections, including Candida species. Number 7, Terbinafine. This is used orally for dermatophytes. Number 8, Naftifine. It is used topically for dermatophytes. And number 10, Butenafine is also used topically for dermatophytes. There are 7 classes of antifungal drugs, and these are polyenes, pyrimidine, azoles, allylamines, benzylamines, echinocandins, and griseofulvin. Polyenes are combined with ergosterol to form membrane pores. An example of this are Amphotericin B and Nystatin. And the adverse effects are renal toxicity, hemolytic anemia, and hypokalemia. Pyrimidine is converted to 5-fluorouracil fungal cell and inhibits thymidylate synthase. An example of this is Flucytosine. The adverse effects are liver toxicity, alopecia, and bone marrow suppression. Azoles inhibit ergosterol synthesis, or it inhibit a 14-alpha demethylase. The adverse effects are hormone imbalance, inhibit drug metabolism, especially ketoconazole, and liver toxicity. There are 2 types of azoles, and these are Imidazoles and Triazoles. Examples of azoles are ketoconazole, Clotrimazole, Miconazole, Fluconazole, and Itraconazole. Allylamines inhibit ergosterol synthesis or inhibit squalene monooxygenase. An example of this is Terbinafine. The adverse effect is liver toxicity, and only terbinafine is used systemically. Examples of benzylamines are Naftifine and Butenafine. The mechanism of action is same as for allylamines, which inhibit ergosterol synthesis or inhibit squalene monooxygenase. And this is used topical only. Echinocandins inhibit glucan synthesis. An example of this are Caspofungin, Micafungin, and Anidulafungin. And the adverse effect is it releases histamine. Griseofulvin inhibits mitosis, and the adverse effects are photosensitivity, induced liver metabolism, and liver toxicity. Dental applications, options for treating oral candidiasis are: number 1, clotrimazole oral trushes. Number 2, Nystatin oral pastilles or rinse. And number 3, for more extensive disease, Fluconazole and Itraconazole can be taken orally, and Caspofungin intravenously.